Salatu wassalamu ala Rasulullah. Today I want to talk about a very controversial topic. So in the hospital, I've seen this practice that women come in and I try to ask them their breastfeeding history. So nearly everybody is not up to the standards. If I go to gynecological wards, even there they have misconception, and I don't intentionally or unintentionally they have the formula bottles, so they give it to the baby instead of providing the breast milk to the baby. So there's so many excuses on that. So I will talk some of them. So number one is that if I go to the labor room, so baby is labored by lower C-section, so they say your mom cannot breastfeed the child, so keep the baby away, give him formula for 2 days, and after that she will try to start feeding. But the problem is, after 2 days, when the baby goes back, she don't have that bond, and baby don't have any intention to drink from the mom. So what is the solution on that? So according to the American Academy of Pediatrics, if some baby is born by C-section, you should take the baby and put on the chest of the mom. That way, he is in kangaroo care, so he gets enough heat. At the same time, the bonding starts between the baby and mom, and gradually he is able to take the milk from the mom. So it's the easiest process, but unfortunately, in our private setups, I've seen like 90% of patients, they go through C-section, which is very bad. Number two is that they are not provided by the farm. Instead of mother's feed, they give formula. And I can talk a long lecture on why the babies should be given the breast milk. But today, I'll see the common excuses. So 2 days, baby is not able to drink. And then mom say it didn't let down, so I don't have enough milk. So sorry, I cannot breastfeed. So gradually he has to go on formula feed. And some people start giving the whole milk from the cow and the buffalo, and they have consequences which are not very good. So the most safest and effective feed for the baby is breast milk. So much so that in the United States, if some mother is HIV positive, she don't breastfeed the baby, but they recommend for the nations with infections are very prevalent that if mom is HIV positive still, you should try to feed the baby from mother because the mortality is very high from other infections in these developing nations. So you can imagine how important it is. So the immunity which breast milk provides to the baby is not available in the cow's milk, is not available in the formula. So we have to break that monotony and we'll try to bring the parents towards breastfeeding. So ideally, they should not give anything to the baby except mother's milk for 6 months. But unfortunately, what they do is they say, we don't have enough let on or let down. So the only option with them is that we should start with the formula at the same time. Now, when the baby is drinking milk from the formula, it's much easier to use the feeder. So you don't have to put much energy, just suck it from the feeder. But if he has to do the same thing with the mom, he has to put lots of energy to extract the milk for himself. So what happens? Everybody likes to do the easy things. So baby shifts to the formula gradually, and they don't take milk from mother. Ultimately, our infant mortality rate is very high. So we are the nations we should be most constant to be on breastfeeding. And Allah has given in the Quran that you should breastfeed your child for 2 years. Even at American Academy of Pediatrics, they have increased the limit from 6 months to 1 year. And gradually, you still need the infection protection for the baby, so they should be gone up to 2 years. The other thing is if baby is getting the cow's milk or buffalo milk, the problem is that they cannot digest it properly. It causes bleeding inside. Will prevent the infection. So what should you do? Don't go for formula. Go for mother deliver. It doesn't matter if he is sick. She's given enough painkiller. Baby, it should be on the chest of the mom. Gradually, they will bond and things will start happening gradually. But please don't do that, that you keep the baby away from the mother for 2 days. This is, I think, is a cruelty, and this is, putting the baby on risk. So infant mortality rate in our country is much higher than the Western countries. And they are telling us that breastfeeding is much safer than the formula. And it's another shame on us that the mothers in the West who are working jobs, their breastfeeding rate is much higher than Eastern ladies who don't have to do anything. So it's very, very important that bring the babies to mother, make sure they are breastfed for 2 years. That's how we can protect our baby. It will give a better bonding. It will give the psychological protection. And it will be healthy for the mother as well for the baby. We'll talk next and maybe in another lecture. Thank you.